With CNC for the weather update. Now, more and more South Africans are spending most of their time in dialysis facilities as local renal failure figures are now one of the highest in the continent. According to a report from the Continuing Medical Educational Journal, 5,000 patients have end-stage renal failure. Half of them are awaiting kidney transplant due to declining numbers of deceased donors. Now, to discuss this further, we are in our studios joined by Dr Heleen Bierman. She is a specialist physician at the Urology Hospital in Pretoria. Dr Bierman, goeiemorgen and welcome on Morning Live.
Goeiemorgen, Palesa.
Thank you
for having me.
Thank you very much indeed for your time. Now, I'm sure people at home, would more or less like to know the difference between renal failure as well as kidney failure.
Renal failure, kidney failure is basically the same thing. Renal failure is a decline in the function of kidney function. We divide it in different stages, and once you reach end-stage renal failure, that is when you go on dialysis therapy.
Okay. Now, what are the main causes?
In South Africa and worldwide, the two main causes for kidney failure is hypertension and diabetes.
Okay, so if you have hypertension and diabetes, chances are high that you might find yourself having kidney failure and renal failure as well.
These are considered the main risk factors for diabetes and hypertension, and poor control of hypertension and poor control of diabetes then leads to kidney failure.
So if you're diabetic or you're suffering from hypertension currently, what do you do to prevent, this from occurring?
I think it's very important to be compliant with your therapy, to make sure that you're on the correct therapy and that your healthcare provider screens you on an annual basis for any renal involvement, and then early referral. It's also important to screen for the risk factors of renal failure, which is then hypertension and diabetes, especially in people who have a family history of these conditions.
So as they say, prevention is better than cure. So it's better that you do, have a look at it now rather than later.
Definitely, yes.
Now, how available are dialysis machines, especially to patients who have this disease?
In South Africa, we're in a divided community, and the majority of patients with renal failure fall in the public sector, and that is where there's a big lack of dialysis facilities, and a lot of people never get the opportunity to be treated for kidney failure, and that is a big healthcare disaster in our country. In the private sector, it's not such a big problem. There's lots of dialysis facilities throughout the country, even in small little towns. But the main burden of disease falls within the public sector. And these patients also have a lack of primary healthcare and proper screening and proper treatment to prevent disease. So that's why the burden of disease falls upon the public sector.
Yeah, I hear you, because you also, in some instances hear of people who've got to travel long distances just to get a facility up to 5 times a week.
Exactly. Patients on hemodialysis usually get their treatment 3 times a week. And when I used to work in the public sector, we had lots of patients traveling 3 times a week from a town like Nelspruit to Pretoria for their therapy.
And that's got to be tiring. I mean, the fact that you've got to travel 2 times a week, that long distance every week.
Now, not only is it tiring, but it takes sometimes the breadwinner out of the family, and it makes it impossible for them to maintain a job and to maintain an income for the family. So it's got a huge burden on the family and the community as a whole.
So a remedy to the situation could only be that if our public hospitals could have these machines.
Yes, I think making dialysis more available in the peripheral towns would help the problem. But I'm very passionate about primary healthcare, and I think we can do a lot more in screening for renal disease and screening for the risk factors of renal disease with early and effective treatment. Like you said, prevention is better than cure. Renal failure is a tip of an iceberg, and there's a large proportion of patients with risk factors not knowing it and not being treated. The problem with these diseases, especially hypertension, symptoms only occur when it's already too late. So proper primary healthcare, proper screening and effective therapy is most likely the only solution to our problem.
Now, very quick on this one. Can a patient be cured from renal failure without getting another kidney?
Dialysis is a bridge to transplantation. The average lifespan, or the 50% survival of the 5-year survival is about 50% for patients on hemodialysis. So it's a bridge to transplantation, and transplantation is the only true cure for kidney failure.
Well, Dr. Bierman, that's where we're going to have to leave it, but baie dankie vir u se tyd.
Baie dankie.
Dis 'n plesier. That's Dr. Heleen Bierman. She's a specialist physician at the Urology Hospital in Pretoria, talking more about kidney as well as renal and dialysis as well, and the facilities that we do have in our hospitals here in the country. What do you have for us, Dumelo? Oh, just before we go